President Buhari calls for aggressive case detection and contact tracing to break community transmission of COVID-19 in the country.
More aggressive tracing, tracking, and isolation of those affected or those that have shown symptoms, testing to break the chain of any community transmission.
More Nigerians to benefit from palliative measures in the coming days.
The Presidential Task Force is fine-tuning the expansion of the palliatives for the poor, vulnerable, aged, and others as directed by the President.
Inspector General of Police warns transporters against continued night journeys that violators will face full wrath of the law.
And on Good Morning Nigeria today, we'll revisit states' responses to COVID-19.
Current COVID-19 case standing in Nigeria as this morning is over 400 and counting. Details provided by the Nigeria Center for Disease Control, NCDC, indicates that specifically there are now 407 confirmed COVID-19 cases in 20 states, including the FCT. So far, 128 patients have been discharged, with unfortunate 12 deaths.
That's right, Kyrian. Now, the statistics also indicate a gradual spread into the communities, thereby spiking up the numbers. The federal government has been engendering strategies and collaboration with subnational governments to contain the spread. But it would appear that some states have shown some degree of complacency in implementing some of the measures.
You are absolutely right, Kingsley, because while the federal government has extended the lockdown and stay-at-home measures for another 2 weeks, some states have only just realized the need to equally do so. And if you recall, some states like Anambra and Kano only recently adopted more stringent measures because of imported cases by patients with local travel history. Just to add also that the incident in Kwara State, which compelled the state government to lock down only Offa, where the incident happened, is one scenario. But thankfully, the state government made a U-turn with that decision by enforcing a total lockdown in the state with the contact tracing of the cases. But some state governments are taking lessons from Governor Seyi Makinde of Oyo State, who initiated a rapid testing of 2,000 people to contain the spread of the virus. And that's after he received a clean bill of health following earlier positive status to COVID-19.
Well, Kiran, it's indeed a tale of different strokes. Why some states are still open for business, others are certainly not leaving anything to chance, as lockdowns and curfews are the order of the day. Lagos remains at the forefront with a house-to-house search for COVID-19 cases after recording well over 203 cases. Katsina is towing a similar line, that's to say house-to-house search for persons who return to the state from Abuja and Lagos, just as those state official has confirmed lately that it is tracing nearly 300 cases following the incident in the state.
And some states like Delta, Gombe, and Osun, on the other hand, have also extended its lockdown order. From the daily increase across the country in 20 states, one would wonder what states are actually doing in complementing government's efforts, or are they still in denial of the global pandemic? What is the level of social distancing in the face of increase in community transmission? All these issues and more we shall x-ray on Good Morning Nigeria today, reaching you live as usual on the network service of the NTA. My name is Kyrian Umayo.
All right. Now, when we took the first set of reports from the states with regard to the update on what they were doing on COVID-19. We've hosted, of course, a number of state executives, including those of Plateau, Ondo, Abia, and Kebbi on Good Morning Nigeria. And they've shared their own experiences, but there are increasing number of cases in various states, and that, of course, will make it expedient for us to constantly check out how the state governments are doing with regard to their containment measures, and as well as addressing secondary implications of the pandemic, not just on the residents of the states, but also on the healthcare infrastructure and the local economy. I join my colleague Kiran Dumaya to also welcome you to this edition of the program. My name is Kingsley Osadolo, and in the course of the program, we have our regular complimentary segments, and these include newspaper review and others. For now, let's join our other colleague, Claire Adelabu Abdulrazak, with the highlights of the morning news. Good morning, Claire.
Hi, Kingsley and Kieran, and let's begin straight away, of course, with the COVID-19 update. And the Nigeria Center for Disease Control, NCDC, says as at 11:20 p.m. on the 15th of April, 34 new cases of COVID-19 have been reported in Nigeria, bringing the number of confirmed cases to 407. Now, of the 34 new cases, 18 are in Lagos, 12 in Kano, 2 in Katsina, and 1 in Delta and Niger H. The NCDC says 128 patients have so far been discharged, while the death toll stands at 12. President Muhammadu Buhari has made a case for aggressive case detection and contact tracing towards flattening the curve as well as breaking community transmission, and that's that efforts are intensified to control and contain the coronavirus pandemic in parts of the country. This is while teleconferencing with members of the Presidential Task Force on COVID-19 in furtherance of its strategic engagement for appropriate response to a common health challenge confronting mankind.
Mr. President was able to hear from them firsthand, not a report through the leadership as embodied in my person. He did ask some questions, he did make some contributions on basic issues and gave certain directives on ensuring that those directives are complied with. From Mr. President, I believe, would go a long way in helping the members of the committee become more determined and more resolute in the pursuit of this thing.
And as Nigeria takes drastic measures to contain the spread of the coronavirus, the Buhari administration has been mindful of reducing the toll such drastic measures could have on poor and vulnerable Nigerians. Now, the good news is that there is a plan to incorporate more citizens that will benefit from the palliatives in the coming days. This was unveiled during Wednesday's Presidential Task Force on COVID-19.
Fine-tuning the expansion of the palliatives for the poor, vulnerable, aged, and others as directed by the President. We shall reach out to all these groups very, very soon.
It is critical that we learn how to properly put on the masks and take them off by their hands. Once you touch the mask, especially when you touch the inside surface of the mask, that's exactly where we don't need you touching.
I appeal to citizens to comply with invitations to isolation centers. This is your best option of recovery and for detecting possible complications in time.
Quite instructive there. Now, allowing movement and distribution of food, pharmaceutical items, and other essential products across the country is one unique and critical measure put in place to cushion the hardship associated with lockdown due to COVID-19. The Presidential Task Force has also constituted a well-established situation room with a view to monitoring and ensuring that the order of free movement of agricultural produce and products is not violated.
The mandate of this Emergency Operations Center is to facilitate the sustainability of production of essential commodities during the COVID-19 pandemic, facilitate the unhindered delivery of essential commodities across the country.
We facilitated the delivery of humanitarian relief 2 days ago. Yeah, trailer of rice and trailer of spaghetti.
Manufacturers of fertilizer to be able to make sure that fertilizer gets to the farmers so that the harvest of this year isn't disrupted by this pandemic.
Meanwhile, federal government is providing uninterrupted electricity for isolation centers as Nigeria battles coronavirus pandemic. This is the initiative of the COVID-19 Power Sector Emergency Intervention Program.
In our mandate to serve clean, reliable power to the underserved and unserved communities in the country, I assure you we'll continue to try our best.
So this is like a backup, and this is what every facility like this needs.
This will definitely help us to ensure that the patients are comfortable.
And here in Abuja, to curtail the spread of COVID-19 cases in the territory, the Federal Capital Territory Administration has introduced new measures to enforce compliance of the extension of the Cessation of Movement Directive in the FCT. FCT Minister Mohammed Musa Bello, who made this known after a Security Committee meeting, also said part of the measures is reduction in number of days for market operations in the territory. And the Inspector General of Police, Mohammed Adamu, has warned that tough consequences await members of the organized transport sector who continue to breach the existing restriction order by resorting to night travels, a development that has proven to be counterproductive as it undermines the efforts of the federal government in curbing the spread of deadly COVID-19. Consequently, the IGP has directed commissioners of police to ensure full implementation of the restriction order, especially as it relates to night travels, without being unmindful of categories of exempted persons and the fundamental human rights of Nigerians. And those are the news highlights for now. The news studio will be live again at 10. But Good Morning Nigerian COVID-19 situation reports from states will continue with Kingsley and Kieran just after this break.
You're on to Good Morning Nigeria. Now let's go business. Federal government grants waiver to small-scale businesses within the lockdown period. Details on business news with Comfort Amodu.
With coronavirus waging war against global economy, countries are taking measures to combat the pandemic to prevent nations from slipping into recession. For instance, International Monetary Fund predicts Nigeria's economy to contract by 3.4% in 2020, but rebound with 2.4% growth in 2021. This is evident in the drop in crude oil prices as low as $17 per barrel by the end of March, with Dow Jones and FTSE 100 declining by 23.8% between January and March 2020, and global airlines losing about $252 billion in revenues. The federal government is providing a waiver for small-scale businesses to continue to strive during the lockdown period. Ministry of Industry, Trade and Investment has also been directed to come up with modalities that would ensure producers of food, water and other pharmaceutical consumables have free access to road and by-products during the period.
To assist everybody to be able to evacuate their products. We don't want the country to be in a complete standstill during the lockdown period, which is why government has given this special waiver for manufacturers, especially manufacturers of essential commodities.
The fourth mandate of this committee is to ensure strict compliance by all personnel of all the extant COVID-19 prevention and control guidelines released by the Federal Ministry of Health and the Nigeria Center for Disease Control, NCDC, at all points of production, delivery and retail across the nation.
And in conformity with the rules and regulations guiding federal government's public financial expenditure, Minister of Humanitarian Affairs, Disaster Management and Social Development, Sadia Umar Farouk, has signed a payment mandate for the disbursement of funds to 500,000 NPAR enrollees across the country, including outstanding payments of their monthly entitlements. The Central Bank of Nigeria has received loan applications from more than 80,000 businesses and individuals 3 weeks after the Central Bank of Nigeria released the guidelines for the for the 50 billion naira targeted credit facility stimulus package to support households and the micro, small and medium enterprises affected by COVID-19 pandemic. The managing director, National Microfinance Bank, Abubakar Kure, confirmed this during a media briefing in Abuja. And this is how stocks traded on the floor of the Nigerian Stock Exchange. With business news, Comfort Amadou.
Many thanks, Comfort Amodo, for the business package. Next on the program is Newspaper Review.
And Bayo Atoyebi is here for today's newspaper review. Very good morning and welcome.
Thank you, Kirian. Good morning. Good morning, Kinsley.
Good
morning, Nigeria.
All right. Let's start with the Daily Punch, the Punch newspaper. Above the nameplate of Punch, we have COVID-19. Nigeria, South Africa, others lose $4.2 billion, according to IMF. The story is on page 17. Federal government pays 200 billion naira to offset Genco's gas bills. That's on page 15. And it's according to Kerry. Katsina, highest recipient of conditional cash disbursement. It's on page 15. A security agent killed 18 during lockdown. That's according to the National Human Rights Commission, NHRC. Details on page 11. And now below the nameplate of the Punch newspaper, let's go to the lead story. Samples. Lagos creates 20 centers. FCT combs residents' houses. Now, it has 4 riders to that. 51-year-old doctor treating COVID-19 patient dies at Luth. 31 discharged in Lagos, Osho, and FCT. Sanwo-Olu awaits Jack Ma's kit. I volunteered to donate my blood for coronavirus research, says Makinde. Or of course, you can see the photo stories there. Indicating lockdown and of course sharing of some of the foods for palliative measures being carried out by government. Now that's Lagos, Ogun and Abuja on that photo story. Then below that we have 60 isolated as Kano coronavirus cases rise to 9. And now we hear it's 12, but this paper carried 9. It's on page 8. CAN declares 1 week daily prayers against coronavirus. Page 10 is where you have that story. The northern groups oppose governor's request for COVID-19 fund. It's on page 11. We have not discussed Ondo polls postponement, according to INEC. The story is in details on page 12. 360 arrested in Nasarawa for flouting restriction order. It's on page 9. And the police probe alleged 69 million naira diversion by Kogi ex-commissioner. It's on page 10.
All right, let's take a look at the Nation newspaper. Above the name flag of the Nation newspaper, El-Rufai, that's the kicker. I'm still positive. And Governor chairs ESCO, that is Executive Council meeting of the state. This was done by video conferencing. Details of that story can be found on page 8. Autumn cuts Benue budget by 70 billion naira. And lawmakers to get bill. That's on page 27. Governors seek control of palliatives and demand federal cash. Details on page 28. Below the name flag, IMF to Nigeria invests $3.5 billion in healthcare and education. That's on page 29. And Tinubu, massive spending way out of economic crisis, as APC stalwart gives post-virus revival appeal. And then the photograph there on the front page shows the headquarters of the Corporate Affairs Commission in Abuja, part of which was burnt yesterday. I think it was just the floor that was affected. 32 patients discharged in FCT, Kaduna, Lagos, and Osun. And break COVID-19 transmission link, Buhari urges PTF. And right at the foot of the front page, Benue and Taraba agree on return of displaced persons. And NHRC, that's the Human Rights Commission, gets 105 petitions. Details on page 5. Back again to the sidebar that the nation uses to illustrate its front page in terms of the COVID-19 numbers worldwide and also in Nigeria. You can see there, globally, well over now 2 million, and fatalities over 133,000. And recoveries, over 500,000 persons have recovered. But when you look at country by country, cases and fatalities, the U.S. is way ahead of all others. U.S. has over 600,000 cases, and all others having, Spain, for instance, 177,000, Italy, 165, France, 147. And over 28,000 persons are reported, according to the sidebar, to have died in the U.S. And then, of course, for us here in Nigeria, total number of cases, 407, fatalities, 12, and recoveries, 128. So you still have 267 active cases. In terms of case numbers, totality now, Lagos 232, FCT 58, Osun 20, Kano has leapfrogged every other state that was way ahead of it, and is now number 4 with 16. And then just below that, below the sidebar, we have a number of riders on stories relating to COVID-19. Niger turns back Lagos travelers. Ogun gets molecular laboratory, and those qualified for cash transfer. Lagos to feed 100,000 youths. Daily testing capacity now 3,000. Door-to-door sample collection begins in Lagos and Federal Capital Territory. CAN, Christian Association of Nigeria, calls for 7-day prayers. Abdul Razak, that's the governor of Kwara, holds virtual ESCO. Doctor dies after treating patient. That's coronavirus now. And world leaders knock Trump over withdrawal of WHO funding.
Well, the COVID-19 is still dominating the stories, but the president has given instructions to the presidential task force, and he has ordered them to double their efforts at holding the spread of COVID-19. The president has challenged the SGF-led presidential task force to break the chain of looming community transmission and quickly trace, find the people, and also conduct necessary tests so as far as possible, so as to flatten the curve of transmission. New measures has also been introduced. This include looking at the economy during the COVID-19 period, and also to look ahead how it will not affect agriculture adversely. The distribution of palliative has also come into the fore, and the minister in charge, Hajia Sadia Farouk, says that the ministry has 3 targeted options. People who are in the informal sector and learn a living by that. The other category are the daily wage earners, and their concern also is for the people living with disabilities. And in trying to reach them, the minister says that they are going to use the social investment register. Meanwhile, the focus is on the urban poor, and they are looking at instances of people who whose bank accounts are less than 5,000 and below, and they'll be using the bank verification account number for that. Another category is people who top up their credit on their telephones of 100 naira or less. Those two will be looked at. But initial target is the 25% of the urban poor. This, the minister says, could be extended. Meanwhile, for the area of distribution of food materials, the minister has indicated that they will use the accessories of the state government. Meanwhile, the National Emergency Management Agency will also use its structure at the national, state, and local government level to help distribute the food supplies to cushion off the effect of the lockdown. Meanwhile, the status report indicates that so far there are 34 new cases have been reported, bringing it to a total of 407. The breakdown which was provided indicate that Lagos had as many as 18, and Kano had 12. But the Commissioner of Health in Kano State has disputed that. He said Kano actually had 21. And therefore, if that is added, then it means the status of what we have now is 411. And if you look at the 128 patients that have been discharged so far, it means the active cases we have in Nigeria is about 279 or thereabout. There have been patients that have been discharged from Lagos, Akwa Ibom, and Osun. In Cross River State and Akwa Ibom, specifically Unuyo, the Commissioner for Health said that 6 out of the 9 persons who tested positive have now been discharged. In Kaduna, Governor Nasir El-Rufai says that he still tested positive. However, he presided over the State Executive Council through video conferencing yesterday. And he says whenever he tests negative, he will be the first to announce it. And so people should ignore all the fake news going on in the social media. Meanwhile, attention has been drawn to Lassa fever because of the hula baloo over COVID-19. Attention has shifted from Lassa fever, and our attention is being drawn that Lassa fever has killed more than COVID-19. For instance, the figures compare that between February and now, there have been 963 cases of Lassa fever in 27 states, and so far, 186 citizens have died. If you compare that to the corona, as of today, we have had about 411 cases, and the death totals have been just 12. And so they are saying that we need to pay more attention to Lassa fever, particularly that it is a disease that is ravaging the rural poor. As at February, when the last episode was found and up to date, we have lost as many as 188. Lassa fever, you will recall, was discovered 51 years ago in 1969. And if you go by the year-by-year statistics, in 2019, there were 801 cases, 2018, 633, and 2017, 308. And already this year, already has 963. So it is on the rise, and we need to look at that.
You know, we have said this a number of times,
yes.
You know, that other illnesses are still in existence, and people are also down of those illnesses. Lassa fever, for instance, you mentioned, to still have malaria and the normal flu cough that we used to have. So coronavirus really, as a pandemic that is ravaging the world, it doesn't necessarily, remove the fact that we still have to deal with other ailments, in the society. Lassa fever, for instance, is very dangerous, considering the number of deaths have just read out there.
Period. I mean, just before we take the editorial, I think it's useful to remind, Nigerians that the very fact that you have some 128 cases recovered, yes, it's good news on its own, but you can see the number of cases is also rising.
Yes.
And that is where the risk is. The number still looks small, under 500, but if it grows exponentially, then you overwhelm the medical facilities, which is what happened even in the advanced world. And that's where the danger lies. And that's why all the measures that have been announced are particularly very important. Kieran.
Well, yes.
And then the other point about payment of palliatives to those with 5,000 naira balance in their bank account. Balance as at what date?
Well, all right. All right, let's go to editorials. It's from the Sun newspaper. Overhauling the National Social Investment Program. The National Assembly leadership apparently spoke the minds of many Nigerians recently when it faulted the multi-billion naira National Social Investment Program. The Senate President Ahmad Lawan and, of course, the Speaker of the House of Representatives, Femi Gbajabiamila, raised issues with the program and demanded its overhaul. Well, that's this, according to the editorial, a cacophony of criticisms trailing the program. But then, the special advisor to the President on Social Investment, Mrs. Mariam Uwais, who supervised the program between November 2015 and September 2019, when it was under the Vice President's office, she made it clear that some of the insinuations may not necessarily be factual, because the program did not go up 2 trillion naira since it was funded in 2016. She said that the total appropriation by the National Assembly is 1.3 trillion naira, and out of this amount, she noted that only 619.1 billion was released for the program between 2016 and October 2019. Let's bring him by now.
Well, indeed, Kirian, the Senate President and Speaker of the House of Representatives have expressed serious concern about the modalities for the social investment and the question about the 12 billion monthly that is said to have been spent on school feeding. They also queried 100 million that was paid to a consultant, and they have insisted that that should be followed up through and should be quiet. Like you rightly said, the special advisor to the president on the social investment program had actually had to correct the wrong impressions. It was alleged that over 2 trillion has been sent, and she had the opportunity to correct that only about 619.1 billion was actually released, and also they gave details of what has how they have been expended. However, the editorial by the Sun is happening on the fact that, yes, it is a bold initiative to use such as a means to provide succor for those who are in their need of it. But then the initiative should not end at just releasing the funds, but they should be followed very closely to make sure that it is useful and effective. In other words, those for which it is intended, it has reached them. The editorial also cited an instance where the First Lady had to criticize that in Kano State, they had not felt the impact. And he cited another example in Adamawa, where out of the 22 local governments, only one local government had benefited from the program. So in a nutshell, those managing the fund should up their act to ensure that it reaches those that is intended.
All right, Bayo, thank you very much. And Kirian, I was just thinking, just before we sign you off, Bayo, there are some forgotten stories, such as you were talking about Lassa fever. But I was also just trying to bring this up. Whatever happened to the boat people? Those who were trying to cross the Mediterranean, going through the desert on Libya, and then heading towards Italy. We haven't heard much about them in the past few weeks. Are they also on lockdown?
Apparently, COVID-19 has stopped everybody.
They are going to countries that are grappling with the pandemic. Yeah.
Big time. Thanks a lot for being around. See you again tomorrow.
Thank you.
Okay, it's Good Morning Nigeria, reaching you live on the network service of the Nigerian Television Authority. We'll take a short break now. When we return, we shall be considering state responses. That's to say, reports from a number of states. You're watching Good Morning Nigeria, reaching you on the network service of the Nigerian Television Authority. Now, as a prompt for our conversation this morning on reports from the states in terms of their responses to COVID-19, let's listen to this background from our correspondent, Abdul Malik Hadio.
To the virus remains in 2 steps. First, to protect the lives of our fellow Nigerians and residents living here, and second, to preserve the livelihoods of workers and business owners.
It's a race against time in Nigeria, and this is evident with the extension of the stay-at-home measure by President Muhammadu Buhari to further contain the spread of COVID-19.
And having carefully considered the briefings and report from the Presidential Task Force and the various options offered, it has become necessary to extend the current restriction of movement in Lagos and Ogun states, as well as the FCT, for another 14 days.
According to the President, the essence of the lockdown in the FCT, Lagos and Ogun state, in the first instance was to use the 2-week containment period to identify, trace and isolate all individuals that have come in contact with confirmed cases, while restricting further spread to other states and ensure the treatment of confirmed cases. Experts say various states have a lot to contend with, owing to concerns like increase in cases of COVID-19, enforcement and compliance of the stay-at-home orders, and well-equipped medical facilities such as isolation centers and testing centers in some states. With increase in the number of cases in 23 states of the Federation, experts say the NCDC report indicating that 99 patients have been discharged from isolation shows that the country is on the right track in curbing the spread of COVID-19 in the country.
We have made significant progress in contact tracing and have to date followed up over 9,000 persons of interest, most of whom have exceeded their 14 days of observation period.
From today, we have to push even harder. Our target, following Mr. President's speech, is to get to 2,000 samples a day in Lagos, 1,000 in Abuja, and 1,000 for the rest of the country.
What is the level of compliance with the stay-at-home order in states across the Federation? Are there new measures put in place by state government to halt the spread of the coronavirus? What is the level of surveillance and vigilance to protect communities from this pandemic? These are questions guests on Good Morning Nigeria would prefer answers to.
That's Abdul Malik with that background. And now to discuss the second part of COVID-19 situation reports from states. Let's first of all welcome His Excellency, the Executive Governor of Nasarawa State, and the President of Engineer Abdullahi Sule, who is here with us in the studio. Excellency, welcome to Good Morning Nigeria.
Thank you very much.
And also with us here, of course, with us in the MENA studio, actually, in Niger State, is Ahmed Ibrahim Mertene, is the Secretary to the State Government. You are indeed welcome to Good Morning Nigeria.
Thank you very much, and welcome viewers. Thank you.
Okay, now two other guests. Two other guests with us on this conversation. One in the studios here is the Acting Secretary of the FCT Health and Human Services Secretariat, Dr. Mohammed Kawu. Dr. Kawu, pleasure to have you again on Good Morning Nigeria.
Thank you.
All right, and joining us via Skype from Anambra State is the State Commissioner for Information, Sidon Adenuba. Sidon, pleasure to have you with us on Good Morning Nigeria.
Thank you, Kingsley, my old friend. Good morning.
Gentlemen, you're welcome to this particular edition of Good Morning Nigeria. And let's begin this conversation with the Governor of Nasarawa State. Yes, your state has not recorded an index case, but your state is also a state that is surrounded by suburbs. They're also densely populated. You're talking about Nyanya, Maraba, Jikoi, and other such areas. What plans do you have on ground at the moment, preparatory for any eventuality?
Thank you very much. Thank you for having us in this program. As a matter of fact, it doesn't excite me. Every day I hear there are increasing cases in FCT. Because as you know, majority of you can say 80% or so of those who are the lower class working in Abuja, either in the hospitals, in the clinics, for the big men, in the hotels, all live in Nasarawa State, and that is a major concern for us in Nasarawa. So we are getting ready more than states that even have the index cases. The reason being, one of the most densely populated local government areas we have in Nasarawa State is Karu. And that is the reason why we decided to have a lockdown in Karu. Because majority of these people have wanting to do with Abuja, and a lot of them do travel out of the country and the rest of that. So we took the same steps like so many other states that have these cases are having. We decided to, first and foremost, lock down Karu local government. We went ahead to say that we restrict movements in the state capital and other major suburb areas in Nasarawa State. We decided to go ahead and reduce the number of, we closed down the markets, in order to reduce this. We also shut down most of the operations that are having maybe religious organizations and the rest of that. So we don't have prayers on Fridays and Sundays and the rest of that. So anywhere there are major gatherings, we decide to reduce that. You will see in the papers today the number of arrests that were made because of violation of some of these gatherings, one of which was actually at an event, of a wedding event that was held by one of the overseers of the development area in the state. And he also was one of those arrested, for violating of these kind of programs. We also went ahead with the building, of our isolation centers. So today we have isolation center, that is almost completed of 300 beds in Lafia. And then every one of the major hospitals, there is an isolation center and a quarantine area for those who are affected. So the way we are scared and getting ready in Nasarawa State is already as if we have the cases. And we can see our fear now happening in Kano, because Kano is actually the most densely populated state in the entire northern Nigeria. So if Kano is affected and it is going this, and it's very scary, so you can think of what is also going to happen in a place like Nasarawa. We strongly believe that we may even have some cases in Nasarawa, but because we have not had the opportunity to test the people who have this kind of contacts. But locally, yesterday during the governor's meeting, Plateau confirmed that they now have a testing center. So a lot of our samples, instead of being sent to Abuja, that is already highly congested, can actually be sent to Plateau, to do that. So we thank the NCDC for confirming Plateau as a test center. So those are the kind of things that we continue to do in Nasarawa State.
Well, Your Excellency, besides the isolation center you mentioned in Lafia, Lafia is at least 3 hours from the FCT. Some of the communities that border the FCT, as you recognize, densely populated. What facilities do you have preparatory to any eventuality in these densely populated areas adjoining the FCT?
No, it's not just, with the FCT, what we have done is that there is a general hospital here in Karu as well, that we have an isolation center in that area. But we are trying to build one in Akwanga as well that is closer, which is more central in the entire area. Yesterday, again, during the governor's meeting, the private sector group that has decided, to support, most of the states had given us the opportunity, to have another center. So we are selecting the general hospital in Akwanga, which is in a more central area of the state, that can have such a center. But we lock down the borders, all of the borders. Our borders with Kaduna, with Plateau, with Benue, and of course the busiest one, which is the one with the FCT. So I had spoken with the FCT minister a couple of times, and we have been able to do a lot of work in ensuring that we lock down the borders, because there was a lot of violations at the borders. We had to plead with the military to assist us. So right now, if you go to the border with the FCT, which is the only border we have military, you will see a lot of military presence. Just yesterday, as I was driving down here, I saw heavy presence of the military also at the border that we have, apart from the other security agencies. So we lock down most of our borders. At the stations, the motor parks and the rest of that you are mentioning, we make sure every passenger that is coming in or going, we take their temperature. Everybody that is coming, we provide all the washing facilities that we have there. We give them soap and water to wash, and then we give them the sanitizers to make sure they do that. We provide them with the mask to take care of that. You see, for some of us who come from the villages, we are usually more prepared than you in the cities. You can see me with my gloves and my this than some of you who are here. So these are the kind of things. So we are really getting ready and getting concerned in Nasarawa. Believe me, I get more concerned every time I hear there is an increase in FCT, probably more than some of the states that even have these cases.
Your Excellency, one of the major concerns since the advent of coronavirus is sort of lack of facilities and equipment required to actually fight the pandemic. You have already reeled out some of the plans that you have. What about equipment? Are you also focusing on that, especially the private personal protective equipment?
You see, it's unfortunate that Nigeria was caught unawares. And it's unfortunate that you can say that this particular pandemic has given Nigeria an opportunity now to think twice, that this is the time not to abandon the healthcare as an area that we have done that. And I will give you a good example with Nasarawa State. Nasarawa State has built, a center, started building a center, that is going to be for all kinds of diseases in that area, Ebola, Lassa, and the rest of that. Perhaps, as what the NCDC informed me, if completed, it will be about 3 times the size of Erua, which is one of the biggest that we have in Edo State. But it wasn't completed. So we used this opportunity, that I'm saying, now to expedite the completion of that. So it was not a priority from when we came in. So, but you can see now nearly every state. When we started with this pandemic, the entire country had only 5 centers, for testing. So today you can see more and more centers that are being created. Most of the countries didn't have ventilators, most of the states. It's today that we are doing that. And we have already ordered a lot of equipment, that are coming, especially the PPEs. We are getting a lot of donations of some of them, and we are buying a lot also on our own. But you see, we are facing 2 pandemics. One is the COVID, the other one is also the hunger virus. So we had to work hard in Nasarawa State, because Nasarawa is a state that is not a rich state at all. So with the hunger virus that we are facing, we had to work very hard to ensure that we provide people with food, with water, and the rest of that. And locally, again, as I said, the private sector is going to assist us, a lot, apart from what the federal government said they will, to ensure that we provide feeding to some of these people. Because when you restrict people who actually make their earnings on a daily basis, and you restrict them from movement, you have to be able to assist them. Otherwise, we are going to have a backlash.
All right. Thank you very much, Governor of Nasarawa State. We're going to have to pause you and then listen in to the reports from our other guests. Earlier, we introduced the Honorable Commissioner for Information in Anambra State, Mr. Sidon Adenuba. Sidon, tell us what is happening in Anambra. And before you do that, I want to give you the foreground, which has to do with the concerns that were always expressed with regard to Anambra. You have some of the largest markets in the country in Onitsha, and you have a lot of population movements in and around the Onitsha area, going up to your capital in Oka, as well as the industrial zone of Nnewi. Right now, what is the COVID status of Anambra?
Well, thank you very much. We are actually the first administration in Nigeria to call attention to the danger of the coronavirus. As early as January 27th, the governor directed the Ministry of Information and Public Enlightenment to advise our people against traveling to especially China and some other countries. And if they must travel, there were certain things they had to do, what we now call precautionary measures. This advice we issued was widely publicized and is still available online. We did so because we are aware that Anambra people travel more than the people of any other state in Nigeria. Therefore, it makes our state at a risk state. As you have pointed out, our people are very entrepreneurial. We have the biggest markets, not just in Nigeria, but also West Africa. We have 63 major markets in Anambra State and over 100 others. Yet, we have only 1 case in Anambra State, and in this case. So, we have not been able to record so many cases because of preventive measures taken since January. The governor advised us and directed us as early as February, all members of the Executive Council, to go to all the markets in the states, to all the major motor parks, to all the hotels, and engage people, because these are places with high populations, to explain to them the dangers and also to tell them what to do. We believe that prevention is better than cure. The costs of prevention is far less than the costs of mitigating this pandemic. In terms of facilities available, medical, that is, to manage the disaster, I am glad to announce that Anambra State is the first state to establish what we call an isolation center, which we call protection center. We do not particularly like the expression isolation center because it tends to demoralize patients with this problem. So we call our own protection center. We are the very first to establish a protection center that meets the standards of the World Health Organization. If you go there in Onitsha, I will actually think you're in a five-star hotel. We are proud of that. We have trained 50 master trainers in collaboration with the World Health Organization and the European Union. And these master trainers are now training other people. So we are cascading down. In terms of what we call isolation centers, we have more than any other states in terms of bed capacity. We used to have only three, and then we have what we call storage centers, 4 more, bringing the total number to 7. So we've been ready for any eventuality. And in terms of the impact on the most vulnerable members of society, the government has provided 200 bags of rice to each of the 181 communities in the states to give to people who are 70 and above. Is going on beautifully.
Don, we have heard you explaining some of the measures taken by Anambra State government before you recorded an index case. Well, let's look at how Anambra got the index case. It's so dramatic that someone came in from Lagos, entered Anambra State, went to 2 different hospitals, and one of the hospitals had a test on him, and he was positive, and he disappeared into the community, and he was haunted, before he was located somewhere in one of the communities. And of course, we heard also that he had contact with the community and as well as a business associates, while in Anambra State. I'm setting this scenario for you to know that, yes, you have one case for now, but the contacts of that person, I'm sure you have about 29 of them being isolated presently, if I'm correct. So the situation is not yet clear in Anambra because those 29 persons have not actually had results from the test. Tell us more about this index case and what it portends for Anambra going forward. Because you say you had an enlightenment program more than any other state in Nigeria, yet that incident took place.
Well, let me tell you this. The index case is a personal friend of mine. Before I came into government 2 years ago, he was actually my client. I was running a consulting firm, and he was my client, a very nice person. He did not know he contracted it. He got to know only last Saturday, in the early hours of Saturday, when our team got to him. He was in a hospital where he was, where samples were taken. The result had not been published. By the time he was, in my humble opinion, wrongly released. So he went to stay in what I may call a guest house. While he was there, the results came out, announced by the Nigerian Center for Disease Control in Abuja. So our team had to search for him. It was very late. The results came out around 8:30 p.m. So by the time we got in touch with him, it was around 3 a.m. And we quickly took him from where he was to our protection center. It was, as I've said, only at that time he knew. He is a law-abiding citizen, a successful businessman. And if he knew, he certainly would have engaged in social activities as he did. Since he has been with us, he's been very, very cooperative. As expected, some people are politicizing the matter. An election is about to take place in Anambra State, a governorship election. So you have all kinds of interests. But the government has consistently advised our people, including the political class, there are certain things you don't play policies with, including human life. This time, it's not just the life of an individual that is involved. The lives of Anambra people. We are about 7 million people. Therefore, don't play politics with this. Human life is sacred. I think the people are complying, that the political class. The business class has complied very well. We shut down the markets, everybody complied, no protests, everything going on very, very well. We have not achieved 100% compliance.
All right, sit down. Thank you very much there for your response. Kieran, the other leg of it, I'm sure when we have the time of getting back to Sidon, he might tell us what they are doing with contact tracing. Because you talked about 29 persons, who were in contact with the index case in Anambra. So what has been done? Do you have all 29 of them, or do you have more numbers now? And when are the results likely to come out? Dr. Kawu, I mean, part of what Sidon just explained is indeed an international challenge. Perhaps one of the most visible faces in tackling this is Dr. Anthony Fauci of the US. And he's talked about this time lag between when a suspect is taken in for testing and when the results of the test come out, because you don't have rapid tests that you can do, and so almost immediately, like a malaria test, you have your results. Probably need about 24, 48 hours, and the person he cannot be detained while the results are waited. Now the person takes off, and suddenly the results come out, he or she is positive, and then you have to keep tracing and tracking those the person had been in contact with. Do you have any such challenge, say, in the Federal Capital Territory? That's one. And secondly, since the last time we had you on Good Morning Nigeria about a week ago, what is the latest update?
All right, thank you so much. Let me start with the latest update before you get to the other question. In FCT, we have 58 confirmed cases as of today. We discharged 22. We lost 2, unfortunately, as you are aware. The 2 we lost had comorbidities, the 2 of them. One of the most important updates is that our facility at Asoko Hospital has come live. Presently, we have started admitting patients there. We have trained over 240 staff, mixed of doctors, nurses, pharmacists, laboratory scientists, including technical guys, those that fix the electricity, those that fix the water, because you cannot expose somebody who does not know anything about this, and things can go wrong, so somebody has to enter and fix some things. So proactively we went ahead and trained these artisans that do maintenance. We also trained the security that guard the place. You'll be surprised, somebody will curiously walk into that facility wanting to know what is happening as a security man if he doesn't know what is going to go through. So we had to train them, not for them to go and manage the patients, but for them to know the implication of what is going to happen. So we did all these things, and we are expanding also bed capacity, although presently things have started coming down in FCT, but we are still not comfortable. We have the Karu Hospital, as I said earlier, is almost ready. We're going to add beds there. Then the Disney Dome, the Edu Treatment Center is also ready, beds fixed. So in FCT we are ready. What we most importantly started doing is to get more people traced and tested. We are not comfortable because the people in Maitama, our largest patients came from Maitama area and Wusetu. And most of the guys that work for them live around Papia and the suburb. So we have taken active case search, active testing in those communities. We started that 2 days ago. You must have seen this in the papers. All trying to get everybody that needs to be tested. Everybody must be fished out. As His Excellency said, we have Karu suburb, Nyanya, and all other places. So we've started going to the communities, and we have to go to the communities and find out if we have cases. So far, I can confirm to you all the tests we did in Pape, about 29, none of them is positive. All came negative. And the other aspect we are doing is to station all our secondary healthcare facilities. We have heard that the federal government has redefined the modalities of testing. Before, you have to have history of travel, you have to have this, but now anybody with respiratory infection, symptoms and signs are going to be tested. So if you have cough, catarrh, fever, sore throat, in all our facilities, we've trained them, we've sent PPEs in large quantities, and we have trained all our laboratory scientists in those facilities. So any patient coming with cough, catarrh, and all those kind of symptoms are going to be tested. You can only diagnose a patient if you have investigated. If you decide not to test, not to seek, you may not get one. And it will be very, very dangerous. So you have to test more so that you fish out those that are there and treat. Now, coming to the question you asked earlier concerning the lack, that is why NCDC said, if you have any history of travel or symptoms, come forward and get tested and self-isolate until the result is out. It's difficult to pack everybody and keep in one place. We don't have the resources. We are not ready for that. But with right information, that look, if you travel outside and come back from an area of pandemic, or you have contact with somebody who is infected, please get across to the state, a pit unit, and get tested. While the results is being awaited, please stay alone. Isolate yourself. The result is out. So this is the only way that you can do that. So the most important thing is the correct information that should go to the people. Right. And I'm happy that people are cooperating.
All right, thank you very much indeed. I think a takeaway from his analysis is the issue of carrying out broader tests, in areas that are suspected, like he mentioned, the Pape area, which is also a densely populated area as well in this part of Abuja. All right, let's go to Minna. That's the capital of Niger State, where we have the secretary to the state government, Ahmed Ibrahim. Ahmed, we were privileged to host your governor last week on this very issue. And of course, you raised some concerns and of course, what the state has been able to do with respect to the fight against the coronavirus. Now you have about 2 cases in Niger State. And of course, I'm sure you're observing a lockdown. Now tell us more about compliance with the lockdown measure and other measures put in place by Niger State to ensure that the cases do not escalate in that state. Of course, you have one of densely populated areas as well, such as Suleja and perhaps other communities. So tell us about the latest development with respect to Niger State measures towards fighting COVID-19.
Well, thank you very much. I'm happy, the executive governor of the state, had an interaction, with your team, and he has really listed, some of those measures that Niger State government has taken, towards the containment, of the virus. Well, these measures, in summary, include, all schools are closed down, all motor parks, are closed down, all markets, are closed down. Some of these measures, we started them before even the confirmed cases, that we have today, because we believed, that that was the best way to go. Many states, thought we overreacted, but believe me, those measures, have helped, to reduce perhaps, the number of index cases today. As it is, we have also strengthened the measures. We have continued to observe 24 hours, lockdown, for the first 3 days, Monday to, Wednesday. Thursday today has been a bit window of for people to go and replenish whatever they are going to acquire, essential households, items. and then we close again, for Friday, Saturday, and Sunday, and then open up on Monday. Now, during this time, all of these movements, all of these activities are highly restricted. The other one that we've done is to profile all border points, about 25 of them, and we make sure that we put sufficient, enforcement along those borders, so that people who are coming in, from other states are highly, profiled and checked, by medical staff. And then if they are not carrying essential items, they are also they are asked not to enter the state. For those who, try to enter, we actually return them back. There are a few cases of that in the last 2 days. Now, secondly, we also have been talking, with the clerics, both the Muslims and Christians, to see how they can, inform their followers. You know that, in the last 2 Juma prayers, we never observed them because of the understanding we had with the imams. The same thing, the Christians on Saturday services, Sunday services. So this, we have gotten high level of compliance, and we are again, increasing our sensitization for self-distancing, and of course, making people understand that self-discipline is important. There is so much government can do in terms of measures, but discipline is what is key, to the containment of, this virus. Well, you cannot be draconian in terms of telling people, to keep distance, when they are in a gathering. You can also, just persuade them, not to go into social, activities like naming ceremonies, wedding ceremonies, and the rest of it. And because of the size of the state, we really had to, spread, this sensitization through different, media, and this has been paying off. Secondly, we also have experienced, we never had these cases until just recently. Yesterday we had a second case, and these 2 cases had a history of travels, from Lagos, and fortunate enough, the communities have been cooperating with us, because in all of these 2 cases, it was the communities that have actually raised the alarm, that we had these persons, coming from these destinations, and we never trusted them. So it is important that government should respond. And in all of those cases, we responded, picked up, these people, and then brought them to isolation centers. So far, we have about 12 isolation centers across the state. Each emirate has an isolation center. In urban areas, we have, 2 or 3, as the case may be, because based on the population. And so all of this, part of, the measures that have been put in place, and of course, we're getting, very good compliance, from people through education, through communication, and enlightenment.
SSG, Niger State, what is your testing capability at the moment? Other than just taking temperatures at the entry and exit points into the state, you have 2 cases. Well, are you undertaking random testing? We have seen what the FCT is doing on account, of course, of the number of cases that it has to deal with, but because there are also contacts, so it's having to test randomly. Does Niger State have that capacity or capability, considering that you are one of the adjacent states to the FCT?
Unfortunately, that is our weak point. We do not have capacity, for testing. All the tests that were conducted were actually, done in Abuja. And this is one of the things that His Excellency the Governor is trying to see if we can have rapid, test kits. But we're also told that, even if you do, tests, they have to be confirmed, by NCDC. So, but nevertheless, it is important to really test people, because we might assume, these numbers, but like you rightly said, contacts, are high. The first confirmed case that we had to do a contact tracing of about 50 people. These 50 people, we had to quarantine them. We also had to quarantine a whole of the streets where this victim, was involved. And of course, we needed to keep them in isolation for another 2 weeks. But so these are some of the issues. If you do not have capacity for rapid testing, you never know who actually has the virus. And of course, previous contacts now also important. And if you do not have cooperation of those involved, who genuinely give you their travel history, or the communities themselves, throwing up these people to say, oh, we knew this person, just came back and he has shown some symptoms, it is very difficult. And I think this is an area that needs a quick intervention, by federal government. And of course, I'm happy, my colleague, from FCT has said, oh, they are, also established some isolation centers. Suleja, Madala, and of course Zuba are major areas. 70% to 80% of the people who work in Abuja actually find their destination in part of Niger. So we need this collaborative approach in a way that together we can be able to curtail the spread. Thank you.
I think that is key, that collaborative aspect of that, because Suleja, Madala, Zubara, he mentioned, people who live there work in Abuja, and incidentally, they are parts of Niger State. And now, back here in the studio, where we have the governor of Nasarawa State, Engineer Abdullahi Sule. Your Excellency, you have already taken bold steps towards combating the virus, even when you don't have any case yet. That's, of course, a proactive action that you have taken. And, of course, you have laid out some of the plans that you have. Let's talk about the medical personnel available to you, to your state. What kind of training have they been getting, since the advent of coronavirus? And what about the testing capacity? I Kingsley just asked the SSG of Niger State, the testing capacity. Now, you talked about the fact that we have a testing, Jos has now been designated as a testing place, and of course Abuja as well is. What kind of synergy exists between Nasarawa State and Abuja?
Okay, thank you very much. Actually, the gentleman from Niger was saying it's a weakness. It is really not. When we started, the entire Nigeria had only 5 testing centers. The entire Nigeria. There were only 5, and there were only 2 in the north. And that's one in Abuja and the one in Kano. And even then the governor of Kano said the one in Kano was not even functional at that moment, so they had to work on it. So it is not a weakness because we don't have that. I think if there is anything, is some kind of neglect that we as leaders have given to the healthcare services, which I said is an unfortunate opportunity, but it is an opportunity now for every leadership to give that. Now, I mentioned to you in Nasarawa State, the previous administration of Tanko Almakura has started building what they call a diagnostic center, which if completed, will have been like 3 times the size of Irwa. We'll have testing centers, we'll have isolation areas, we'll have quarantine areas, and all the rest of that. And it was started when Ebola actually broke out, but it wasn't a priority project, otherwise it would have been completed. So it is now that we are completing that. We are in the process of completing that with a lot of partnership and support that we are getting from development partners, individuals, as well as the state government itself. So that is the capacity that we are doing, but we are going to utilize, all the other advantages that we have, both in Abuja as because you can look at it, if you look at it right now, the entire Nigeria a few days ago had only tested 5,000 people out of a population of over 200,000 people. And 200 million people, sorry. If you look at the size of South Africa had tested 75,000 people at that time. 75,000 people. What's the population of South Africa? 1/3 the size of Nigeria or more? That's what we have. So we actually needed to do more. And I'm happy that we are all doing more. One of the decisions that we had taken and the plea that we had sent to the federal government is that every state now will have a testing center. Every state. And that was what we discussed with the World Bank, we discussed with the federal government, and as states, we are also making various efforts, like I mentioned. Nasarawa will have its own completed very soon, and will take it more seriously. One of the issues actually discussed is about preparedness. A gentleman from Enugu or Anambra was mentioning that the reason why they don't have much cases is because of how prepared they were. I don't think so, really. I think part of the issue, all those states that are having these cases, is not because the state government or the FCT had done anything wrong. That's why they are having that. You know, when you are having these exposures and you are having these kind of problems, you are just going to have that. It's not because you are doing something right or something wrong. You know, when it comes to the healthcare, the entire Nigeria, you know, as a leadership, didn't give attention much to the healthcare services. That's the reason why we're having what we're having today, and we don't have the opportunity to test. And the reason why every state is getting ready to have these huge facilities in isolation centers is people are afraid of, by the time you start testing, the president had given NCDC, you know, the mandate that they must be testing 5,000 people daily. Today they say they only have capacity in the country for 3,000. But you see, capacity is one, capacity utilization is another. So maybe they will have 3,000 capacity. They may only be able to be testing because of the nature of the test that we are carrying out, from what the doctors are saying. Because of the nature of the testing we are carrying out, it's not rapid, and it is going to take a little longer. So they may only be able to have capacity utilization of just 2,000. So if we are doing 2,000 a day, you know, for the next 2 weeks, the 2 weeks that we have given, if you multiply that, then you will see maybe roughly only going to have about 28,000 people, which is far less than what I said, you know, we have had in South Africa today. So these are the challenges that are there. But, you know, instead of crying foul over all the challenges, is to put heads together. Locally, Nigerians are given leadership the greatest, you know, opportunity. It's a lot of lack of understanding of some other people, and hunger also part of it. You know, a lot of people, like I said, can only earn their living for that day when they go out. If they are not able to go out, that's it. When I came to the border last time, you know, the border with Abuja, I saw a lot of people wanting to say, we are going into Abuja. I say, I just came out of Abuja. Even if we allow you to pass, you are not going to be able to enter Abuja. And even if you enter Abuja, there are no offices open for you to go and do business. So please just go back to their homes, you know, so that we have to persuade people. But when you persuade them, you have to also assist with these palliatives. So that's why palliatives has become a major aspect of it. You know, we had every time you talk about religion in Nigeria, you know, we are holier than the Pope and the rest of that. So before we went into the idea, you know, of even shutting down for Easter came in at a time. I'm a student of the Catholic Church, even though I'm a Muslim, but I actually went to school in a Catholic school, and I know how much Easter means to the Christians, especially the Catholics, you know, and that is the reason why before that we call all the Muslim leaders, we call all the Christian leaders in the state, and we say, well, it's Easter, and we have lockdown. What do we do? You know, but a lot of them, believe me, were the ones who suggested that we have to be healthy to celebrate Easter. You know, so let's do whatever it is, you know, to avoid this virus, which was the answer I was looking for anyway, but I wanted it to come from them. You know, so that's the reason why we went into that. So that's where the persuasion comes about. You know, but I think we're all doing our best as various state governors and the federal government. You know, most of the steps we are taking, but they are very difficult steps that we have to take. But hopefully God will take us out of this very difficult situation.
Well, Your Excellency, you know, part of the subtext of what you've been saying in terms of response to the questions that we have posed to you would almost lead us to say that coronavirus in Nigeria is, as it were, a rude awakening to the real essence of governance, more particularly now in the healthcare sector, which, you know, hasn't received the premium attention that it ought to have received. But there's still a lingering issue, and that has to do with the training of medical personnel, you know, to deal with this strange ailment. That's still strange because the medical world is still trying to understand its behavior and how precisely to deal with it. There have been some bizarre instances where medical personnel fled upon seeing a patient, and others also didn't quite know exactly how to handle such a patient. We've had medical personnel here, and the NCDC and the Ministry of Health have said, look, they have organized training for various states. Has Nasarawa been a beneficiary of that training effort by the Federal Ministry of Health and NCDC, and therefore medical personnel now knowing the protocol to adopt? You're still lucky, zero numbers.
Well, you see, locally, that's one of the areas. I think one of the governors yesterday asked during the question, he said that NCDC had asked that we should send our doctors to Lagos for training. And when I was getting ready to send, they said Lagos was not providing any training. So indeed, I don't think most of these states were able to get that. Now, Nasarawa has a little advantage, I think, for us, and we're lucky. Our deputy governor happens to be a medical doctor. So the first thing he did was he went around all these facilities to see, and his concern was the personnel, the manpower. Do we have the right nurses? Do we have the right technicians? Do we have the right people who will be trained? And if not, can we start training them? Can we bring in people? Can we do that? So we're lucky with that. I don't think every state had that opportunity. So he had gone around to ensure his concern was more about the manpower at the various isolation centers and the various hospitals we need. Do we have the right BPE and the rest of that? So our deputy governor had done a wonderful job in that area. So we've been able to establish something. The first time I went into what we call the isolation center in Akwanga, I only saw one nurse, that was sitting there. And for me, being an engineer, I thought that was enough. And he came and said, no, that's not what we need. We need people in this area like I think the gentleman from FCT mentioned earlier on. They need the technicians, a plumber, an electrician, and this, in order to take care of some of the facilities that are there. So I think that's what we have been able to do. But saying there was going to be training and the rest of that. And let me tell you one little story about all these problems. That's why we are getting people from China, to come in, because they have done that. But believe me, the situation in one country is different from the situation in another. The way they treat this virus in China may be different from the way we will treat it in Nigeria. But do we need the training? You just need the training, because as a professional, any training that will come to you, you want to take it. I was living in the U.S., in Houston, Texas, when actually I came into Nigeria for 2 weeks holidays, and then I got malaria. When I got that malaria, on arrival back at work, if you see the way I was quarantined for malaria, nearly every big doctor at the Memorial Hospital in Houston was on my head that day. They took me because they were so scared of it to death. Everybody was afraid, that we had malaria because they don't have it. So I think it's similar to what we are going to have in Nigeria. So the way some of our doctors, we have excellent doctors in Nigeria. We have people who understand this, and they are going to approach it the Nigerian way. But if somebody is bringing training to us, Italians come, Chinese come. We don't keep anyone away. But most of these issues will be taken care of by Nigerians who understand how to treat it the Nigerian way.
Okay. Thank you.
Yes, talking about malaria. It is in all of us. So.
Yes, it depends on when your own manifests.
Manifests, absolutely. The load that you have. Yes.
Okay, now let's return to Anambra State, where we have Sidon Adunoba, the Commissioner of Information Anambra State. Sidon, going by your earlier postulations, it does appear that Anambra State is not just prepared, but equipped to fight this coronavirus. So I'd like you to also give us an update of how equipped Anambra is with respect to some of the instruments required to fight this virus. Now tell us also about the current status of the 29 persons who may have had contact with the index case in Anambra. Of course, we know that some health personnel must have been part of it because he attended to 2 hospitals, before the case manifested.
Okay, thanks. In Anambra State, it's not only doctors and nurses we train. We also train cleaners, water cleaners, and they are very, very critical in the value chain. Secondly, I'm happy to announce that the Anambra State government has placed an order for the latest technology in testing coronavirus. I hope in the next 2 weeks it will arrive. It would have arrived last week, but for prevailing circumstances, not only in Nigeria but all over the world. The technology will make it easy for the result to come out. In 15 minutes, the result will be out. So you don't have to wait for 48 hours. I'm also happy to announce that Anambra State has what is called a mega lab. That is to say, a laboratory that can test 500 samples at the same time. It is located at the State University. It is actually from Abbott Laboratories, USA. The only difficulty we're having is that it doesn't have reagents. Reagents are now being ordered. We are also working on the Federal University Teaching Hospital in Inewi. We are assisting it so that it can also become a testing center. By the time we have these two, plus our latest technology, we should be in a position to assist other states. Now, about the contacts, the number is actually more than 29. It was 29 as of 3 days ago. Since then, we have been in touch with a lot of people, and they've been cooperating. Our index case is a highly sociable person, a successful businessman. So he has met with a lot of people, not just in Anambra State, but also in Lagos, where some of his businesses are. As the governor told us on Saturday, he arrived from Lagos on January 28th. Now, the next good news I'm going to give you is that the index case is responding very, very well. In less than 2 weeks, there will be another test. If it's negative, there will be another test. If that works out, then he'll come back into circulation. It is not an accident that we just have one case. As I told you earlier, we began the process of public enlightenment and social mobilization as early as January 27th. You can Google it, you can get the facts. I wish other parts of the country had started the time we did. Prevention is better than cure.
All right, Sidon Adinuba, thank you very much there for what you have said. But I mean, of course, we continue to check out the numbers and the progress that your state is making with regard to expanding the testing capabilities, as well as bringing in more persons under the testing regime that you're having. We are, of course, going to take a short break now. We also have a number of tweets that have come in. Do keep your tweets pretty short. A tweet is supposed to be a tweet. We keep saying that so that we have the opportunity of reading them. But let's take a short break now. When we come back, we'll take a comment from two of the guests and then take the tweets. All right, you're welcome back, and I still Good Morning Nigeria, reaching you live on the network service of the Nigerian Television Authority. Dr. Kawu, Acting Secretary of Health in the FCT. I mean, we know that Abuja, as it were, is, shall we say, the epicenter of number of infections in the FCT, and you talked about the random testing going on now in some of the surrounding locations, Mpape and elsewhere. But what is happening in the satellite towns? Because some of the reports indicated that there's very little social distancing going on, and the lockdown is virtually ineffective in those locations.
Yeah, thank you very much. His Excellency just said something. The most important thing is to get the buy-in of the populace, of our people. It's difficult to go and force people. In trying to solve the problem of COVID-19, if you become overzealous, you go and cause a bigger problem. So, a lot of sensitization is ongoing. A lot of information, correct information from both the medical community and the information and media community is ongoing. Correct information from the political leadership, from the president to the governors to everybody is ongoing. So we have to get the buy-in, the cooperation of every Nigerian. People have to first of all believe that this disease is real and anybody can get it. And if you get it, you can lose your life. And if they are seeing what is happening all over the world, even in countries that we thought were serious and have organized themselves, they are running helter-skelter. So it's very, very important we inform the society. And as the governor has been saying, there is also hunger virus. So the palliative is very, very key. And I'm happy at the highest political level, this issue is being sorted out. The president announced it, all the governors announced it, the Minister of humanitarian crisis has taken it so seriously. The Presidential Advisory Committee is talking about it, and all the states have started. The FCT is going to start going into communities to distribute food. And distributing also has to be orderly, has to be organized, otherwise it's going to create more confusion. So, I agree with you. At the satellite towns, the suburbs, it's not funny. We've been getting reports, but we have also constituted compliance task force led by your colleague, Otairo Ata, who has been going into communities trying to stop people from going out, closing even churches that refuse to comply, and even mosques. So my own is people must be informed. Okay. People must get right information and take decision about their life. Okay. I think that is the key thing.
Okay, all right. Let's get back to Mina, where we have Ahmed Ibrahim. Ahmed Ibrahim, tell us more about the level of compliance in your state with respect to the lockdown. And tell us also what the government's plan is in terms of providing palliatives.
Once again, thank you very much. As I've indicated earlier on, the level of compliance is very high, especially with the lockdown. We have seen the streets empty. We have seen people staying in their houses. And we have seen that people are getting to understand the implications of this virus. And so they are serving as advocates. However, we have seen, again, area that we need to work on, especially social distancing. Many people do not understand that social distancing is key, to the containment of the virus. So we're working on that. People have to use a minimum number of hours given for them, to rush. And then in the process, you see them so cluster and actually defying, the application of social distancing. We're working on that as government. We are also getting volunteers, to support us in this regard. However, for palliatives, of course, if you keep people in their houses, and you need to really provide for them, you need to make their houses very comfortable. In Niger, we have a multifaceted approach, on the issue of palliatives. One of the first things we did, because of the season, we negotiated with electricity distribution company, the AEDC, to see how they could extend, the number of hours for supply of electricity. We succeeded in that. Before the lockdown, we had, on the average, 3 to 4 hours of electricity supply. But today, in some locations, we have up to 18 hours. That came as a cost because we had to pay some subsidy, to get that done. Secondly, we also looked at the area of water supply. This is key because we know that if people cannot have access to clean water, then that will be a problem. So what we have done is to work with the Ministry of Water Resources and the Water Board to, rehabilitate all the water points to ensure that, people get access to water. We also supplemented that, with tanker supplies in locations that do not have, water connectivity. Thirdly, of course, we also, we bought grains or assorted grains, rice, maize, millet, and some other, commodities to distribute across, the entire state. This was also complemented by all the individual local governments. And that is going on, and we are happy that, very helpful Nigerians, are also partnering with us. We have received so many donations in the form of food commodities. We have received so many, support from individual corporate entities that made some medical supplies available to us. So this is helping government, to really, extend, the campaign. However,
sorry, SSG, please, very quickly, because we're getting pressed for time now. You say your entry and exit points have been short, but Niger is a major transit route. So how long are you likely to hold out so that those who want to transit through your state are able to do so with food supplies or whatever? And secondly, and more importantly, is it potentially worrisome that your lockdown isn't synchronized with that of the Federal Capital Territory, which is under a federally mandated lockdown?
You know that, yeah, you rightly pointed out, we have critical border points like the southwest, the whole entire southwest have entry points into Niger through Jeba. So that area we are trying to see that we actually provide, sufficient compliance level. Of course, critical supplies, food items, manufactured goods, pharmaceuticals, and other related allowable, products are allowed entry. However, in the course of entry, we have to check, some medical checks, for those who have eligibility to enter. But for those who do not have no business, traveling at this time, we actually, put them on hold, and of course, in some cases, we turn them back. Of course, we are trying to synchronize, with the federal government, directly, especially on the FCT side, as much as possible. And this is why the collaborative, approach is important. While we are aligning with what the federal government, focus is, we are also looking at internal mechanisms that can deal, with movement, intra and interstate movement. And of course, we are not having any issues, with that. But importantly, critical items, consumable items are allowed entry, and of course, people who are conveying, those products are checked, medically from time to time.
All right, thank you indeed, Ahmed Ibrahim, the SSG of Niger State. Many Nigerians are also making their own contributions via Skype, and they were going to read some of them as much as time can allow us. And we'll begin with this. Innocent Yawal James, he says some Nigerians are in doubt of the existence of this virus in Nigeria because it looks like politics is being infused by some states to the pandemic. It's real, and please let's not downplay it. Other countries are gradually relaxing the lockdown, and Nigerians are aware of that.
Now, Chris Simeon, security operatives in Sokoto State have done well by mounting checkpoints at border locations and ensuring that no vehicle, person or goods and services come in or go out of the state.
Amos says testing is the issue. I believe this disease is everywhere in the country, but people are afraid to call NCDC centers because of fake news which has been spread by ignorant persons in various locations.
Yeah, Ogbeni Zah, that's Bolahom, tweet, say, I'm baffled at what some of governors are doing, those of Oyo and Ondo, for instance. Now, while other state governors consider total lockdown to prevent further spread of COVID-19, the governments of Oyo and Ondo imposed dusk to dawn curfew. Will COVID-19 suspend the spread during those hours people move freely?
Okay, well, you didn't take this Delajak Solomon in a way he said that we implore UNICEF to provide more technical guidance and resources to government-led coordination mechanisms in specific sectors such as risk communication and communication engagement.
Mike Anyakwa said reports from various states show elements of some seriousness. The measures, most of them are taken, are highly commendable, and they're also collaborating with the presidential task force. COVID-19 is an enemy, and we all must work together to fight it.
All right, Festus Akimbe was sad that some state governors have not realized that COVID-19 is a serious threat. While it's not advisable for governors to overreact, mixed messaging from many governors is complicating curbing the spread of the virus, as some states have not imposed lockdown yet.
Then we have this other tweet. It's coming from Festus Akimboewa. It says, sad that some states...
No, that's what I
all right, that's what you're talking. Steve Bond, that's right,
Yeah.
Steve Bond. I have that on my other page. Following the extension of the lockdown, what measures have the federal and state governments put in place to checkmate the rising cases of robberies in villages and towns across the country?
Usman Bonakantu, while state governments have been taking measures to forestall the outbreak or spread of the disease in their states, but it appears that some citizens are not cooperating, largely due to poor dispensation of palliatives.
Bashiru, is there a possibility that the so-called herd immunity is going on in the states, given our youthful population, low level of testing, and low community infection rates?
Okay, I'm a Nigerian staying in South Africa. Frequently, I visit home. The state of the healthcare facility in the two states I visited in January was nothing to talk home about. Enugu State and Anambra in particular, there are conditions. He said there's a condition, or the condition is like an abattoir. Well, I'm not sure you are right, but then most of them won't pass health check. Well, he's talking about specifically about, and I'd like the commissioner to listen to that. He said Enugu and Anambra, that's his own personal assessment anyway. He lives in South Africa and he often comes home, and he's saying that what he saw with respect to our health facilities in Anambra and Enugu are nothing to write home about. That's according to Nemeka Dike.
Well, Kira, I'm going to jump to Chidi Amadi. He says, how are we sure that the reports from the states are cogent? Many of the states just want the funds and attention. Do we have presidential monitors of some sort? Most definitely, that will be useful.
Yeah, okay, now let's go to Rajiv Afiz Abidemi. Thieves are disturbing citizens in Oyo State seriously, and police cannot do the job alone because there are not many. They should allow Peace Corps of Nigeria to join them.
Okay, Okaku David, he says some states rush to prepare for the outbreak without proper preparation. Now they rush to create isolation centers without kits. It's funny how we prepare haphazardly. Can you believe that even up to now, some states don't have what it takes for a simple test?
Fagun Robert, although the country seems to be doing well in tackling COVID-19 pandemic, it can also be opined that the number of reported cases may not be the true reflection of the situation.
All right, Ibu Godwin, Unjoku Oga, Mutana Farouk, Eddie Okones, and others would like to appreciate you for the tweets that you have sent in on this. Your Excellency, let's get the closing thoughts from you. You're pressed for time now. We talked about the medical perspective, but we also recognize that the socio-economic perspective is very critical to the successful management of all of this. How pressing is this, and what would you like to see done?
Well, it is actually very pressing, and it's interesting the amount of effort that we get. Let me use the opportunity first, to express great appreciation to the federal government for the steps that they had taken. Unfortunately, some of the tweets don't understand the amount of steps that have been taken and a lot of work that is being done. So from the federal government, all the way to NCDC itself, for what they have done to the private sector, development partners, is a lot of work that has been done. Let me use the opportunity specifically to thank all the security agencies, for the wonderful thing. Just 2 days ago, all the security agencies, the police, the military, Air Force had a joint effort in order to reduce the level of crime, because one of the things people don't understand is that the crime also is going up, and they had done a wonderful job in Nasarawa, and I want to thank them for that wonderful job.
Yes, we would like to thank you also for your time and your insight, even when you don't have a case yet in your state. Now, Engineer Abdullahi Sule is the Executive Governor of Nasarawa State. Thank you, sir, for coming in. And from our studio, we've been talking to Ibrahim Ahmed, or Ahmed Ibrahim Matene, the SSG of that state. We thank you. We appreciate your time. And we also like to appreciate the Acting Secretary of FCT, Health and Human Services Secretariat, Dr. Mohammed Kau. It's been a pleasure talking to you this morning on Good Morning Nigeria. And C. Don Adenuba, we'd also like to appreciate you, your comments, of course, your contributions. Thank you so much. And of course, we congratulate you as the Commissioner of Information, Anambra State. Well, that's where we conclude today's edition of Good Morning Nigeria. I would like to also ask you to join us again tomorrow when we return with another edition of the program. I am Kirian Umayo.
And I'm Kingsley Osadola. Stay safe.